It's very difficult because, so what the prodrome really means, it's people who have chronic symptoms. It could be fatigue, it could be mild vertigo, headaches. So these things that wouldn't classically be defined as MS specific, and they tend to go off to their family doctors or their primary care physicians and they complain about these symptoms. They may get sent to ear, nose and throat, they may be sent to orthopedics or whatever, and they don't get pinned down as having a multiple sclerosis. So these are people that are utilizing healthcare or have symptoms before they get before they have a classic symptom that brings them to the attention of the neurologist. I don't know how to, at a population level, to pick up prodromal MS. I suspect if somebody was at high risk, in other words, if they were a sibling, a brother or sister with the disease, or a child of somebody with MS, you'd probably be more likely to look at those patients in more detail. But there's no doubt that MS has an asymptomatic period even before prodromal, which could be 5 to 10 years. Then you have this period of prodromal symptoms, and then you have the classic MS event. So all it's telling us is that MS starts long before we have our first attack. And there are pre-symptomatic, asymptomatic phases, and then these symptomatic phases which don't get labeled. I suppose the way to approach this would be to educate primary care physicians, particularly family doctors, about being aware of the kind of symptoms that could be neurological. Obviously, eye doctors, ophthalmologists, orthopedics, spinal surgeons, make people more aware that, some of these symptoms could be related to multiple sclerosis. But apart from doing that, I just don't think we can go out to the population and screen everybody. It's just a daunting task. MS is still quite an uncommon disease, even though we have an incidence of about 7 to 8 per 100,000. It's still, and that's still a small number relative to other diseases in the community. So the kind of symptoms that people complain about in prodromal MS are still likely to be ascribed to something else. That's the problem.